Hi, everyone. This is Dr. Jiha Lee reporting for Room Now for EULAR 2025 in Barcelona, Spain. Today, I'm sharing new real-world data that may challenge our assumptions about conventional synthetic DMARD combinations in RA treatment. This is abstract number 0P or OP0195. It is titled, "Is the Association of Methotrexate and Leflunomide a Safe Strategy? A Cross-Sectional Analysis of the REAL Study, REAL." So, as the title alludes, this is a multi-center observational study from Brazil that evaluated the long-term safety of methotrexate plus leflunomide. Now, this isn't a combination that many clinicians use because of the safety concerns, particularly regarding hepatotoxicity. And I personally can attest I've never really used this combination. But the authors ask, are these concerns really justified? And they set out to answer three fundamental questions. First, does ever use of combining methotrexate and leflunomide increase the risk of liver fibrosis? And is it reflective of cumulative long-term dose as their second question? And as the third question, they were asking, does current use of this combination signal active drug toxicity? So to answer this, they analyzed data from more than 1,000 patients with RA. They consisted mostly of women, average age of 57, and their median disease duration was 12 years. At the time of analysis, about two-thirds, 66%, were on methotrexate, a third were on leflunomide. What's interesting is that in this population, 1 in 4, or 25%, had ever used the combination of methotrexate or leflunomide. Even more striking, 16% were currently on this combination. Now, that really surprised me because, as I mentioned before, this is an uncommon strategy, and it's not something that we commonly see in real-world practice. So, what did they find in terms of safety signals? So, to assess for liver fibrosis, they used non-invasive invasive biomarkers, FIB-4 and APRI, which are commonly used in hepatology to screen for liver fibrosis using routine lab work. Importantly, there were no significant differences in fibrosis scores between users and non-users of the combination of methotrexate and leflunomide. So that's a really strong signal to show that long-term use may not carry the liver risk that we thought was there, and I believe was previously shown in psoriatic disease and older studies. They also found that there was no correlation between the amount of duration or exposure on this combination and degree of fibrosis. Now, when they were looking at signs of current drug use, the combination and toxicity, the ALT was slightly higher in current users, but you really need to look at the numbers because the ALT was 27 compared to 22. Now, it was statistically significant, but the value in and of itself was still within normal ranges. So, really, no increased risk of hepatotoxicity. Now, what's even more, the current combination users had fewer hospitalizations. Now, they didn't specify whether this was for all cores or RA, but the rate was lower at 3.3% among the combination users to 7.9 or 8% among the non-users. Again, statistically significant. So this shows that perhaps there's compelling evidence that this combination is safe, that it actually may lead to lower healthcare utilizations. And this was reaffirmed in multivariable models where they, again, looked at liver toxicity and healthcare utilization and adjusting for other covariates. The findings held out. And why does this matter? Well, it's because there was a debut of a session that they called Fishbowl at EULAR 2025 for the very first time, where they had a panel and audience to engage in meaningful conversation. And one of those topics was about the cost of biologic drugs and treatment decisions, because biologic drugs or targeted synthetic drugs are costly, and it's not equitably available in all countries or resources, and it's dependent on regulatory considerations, cost restrictions, formularies, insurance hurdles, and whatnot. So if this combination of relatively cheap conventional synthetic DMARDs of methotrexate and leflunomide is well tolerated and safe, it presents quite a viable cost-effective alternative potentially to areas that are resource limited. So maybe we need to think about whether to dismiss this combination entirely from our practice. I think after having some very frank conversations about risk versus benefit and understanding patient preferences, I myself might trial this combination in my patients who are really adamant about not doing self-injections or are concerned about out-of-pocket costs. So That said, some caveats to take away to keep in mind. In the abstract, they didn't mention the amount of methotrexate dose, but this was raised in the Q&A sessions, and the authors did mention that on average, patients were on 17 milligrams per week, which is fairly typical, and again, signals that they're using a fair amount of methotrexate in combination with leflunomide. This is an observational study, so causality can't be determined, and there may be some channeling bias of patients who are safer to take combinations being placed on this treatment. And again, this combination, whether it's safer or even more effective than being on biologic, is yet to be determined. But as I mentioned before, in certain circumstances where the needs are met and the risk assessment is adequately performed and monitored, it's a viable option to consider. So for clinicians and in certain constrained environments, and for patients with limited access or strong preferences, this combination may be a pragmatic and reasonable option. It'd be interesting to see if more data emerges from this. So thank you for listening. And again, this was Jiha Lee for Room Now from Barcelona, Spain, covering EULAR 2025. Thank you.